Hi, I'm Cindy from the WVU Medicine Center for Joint Replacement, here to talk to you about taking care of your incision. Most often, your incision will be closed with dissolvable sutures, steri strips, and/or skin glue. You may have what looks like a long piece of medical tape directly on the incision. Please do not remove this tape. Your dressing is to remain on for 4 days. No showering while your dressing is on. After 4 days from surgery, if your dressing is dry, you will take the dressing off and you may shower. If your dressing has drainage, do not shower and please call your surgeon's office. Notify your surgeon or orthopedic nurse clinician if there is any drainage, increased redness, swelling or pain, an odor or heat around the incision, as these are all signs of infection. Check your temperature if you feel warm or sick, and call your surgeon if it exceeds 100.5 degrees after your third postoperative day. It's essential that you elevate your operative leg for 20 minutes 2 to 3 times a day to reduce the swelling and other complications for the first 6 weeks after your surgery. If you have any questions, please contact your orthopedic nurse clinician.